Welcome back. With sandal season just around the corner, it's time to get your feet ready for summer, but you should be paying close attention to your feet all year round, especially if you notice brown spots or other problems on the soles of your feet. And joining me now is New York podiatrist Dr. Oliver Zong to tell us the importance of keeping your feet healthy and looking at the bottoms of them. Thank you so much for being with us this morning. Thanks for coming in.
Thank you. It's good to be here.
So look, good to have you. So look at the bottom of your feet, and very good reason to do that?
Absolutely. Most people never look at the bottom of their feet. When they come into my office and I see a brown spot on the bottom of their feet, I often will ask them, well, do you know you have a birthmark here, or do you know you have a mole here, or how long has this been here, has it changed? And they'll say, what?
What, right, what, exactly. Well, one of the reasons we're talking about this is because of foot melanoma, and you say it's most common in people of color and Asians 30 to 60 years old?
Absolutely. Melanoma can occur anywhere, and most people are under the impression that it can't occur in the feet, or they're not aware that it can, but melanoma can occur anywhere, especially in the feet. And when it does occur in the feet, the population that's mostly affected are people of color and also Asians.
That's bizarre, because I would think that those groups would be safe.
That's what you would think, and I don't really think the researchers know why, but it's
important to know that.
Absolutely.
Let's look at some of the stuff that people should be looking out for, because I know you brought some pictures.
Sure.
What exactly should folks look for?
Well, a real easy mnemonic that every medical student learns is the A, B, C, D, and E's. A stands for asymmetry. That is a lesion that is not a regular shape. It's not perfectly round, or it just looks a little bit funny.
Like that?
Like that. That lesion exactly. You can see that it looks almost like half a star. It's irregular shape. The B stands for border, and border just means that you want a smooth border, and that border there, you can see it's a little bit jagged. C stands for color. Benign lesions usually are homogeneous. That is, they're just one shade of brown or darker color, a blackish brown color. In a malignant lesion, there'll be all sorts of different colors: reds, blues, blacks. D stands for diameter, and there you're talking about size. Usually benign lesions are less than 5 millimeters. It's about the size of a pencil eraser, so a lesion that's larger than that you may want to have checked out. And E is elevation. So elevation, that just means that benign lesions usually are flat. So any raised lesion should also lead to suspicion. Okay,
let's stick with some yucky stuff here. Fungus on your feet.
Fungus, not
What should
good.
folks look for, and what can we do for it?
Well, fungus, if you have it, you probably already know. Exactly what you see up there on the screen, those are some examples of it. The nails get very brittle, they can become very thickened, you can get lots of debris underneath the nail plate, and cosmetically speaking, they're not ideal.
Oh, good, more pictures.
Oh, those are beautiful.
Okay, so do you take a pill, or do you want to spray that? You want to get a pedicure like Marvell? What do we do?
Well, you can get a pedicure, but the pedicure, what it will do is just make the nail a little bit trimmer. It won't do anything about the fungus. The only way to really treat the fungus is either with a topical or an oral medication. And there's a couple of preparations out there, such as Penlac, such as oral Lamisil, which are commonly used.
Clears it up how fast?
Penlac clears it up maybe a year. The oral medication is a little bit more effective, clears it up in maybe 3 months.
Dr. Zong, thank you so much. Very important information. Melanoma can kill you, so it's important. Thank you very much.